Hello, welcome to the Department of Health Provider Training short introductory video about emergency transporting of COVID-19 vaccines. Packing vaccines for transfer during emergencies. Be ready before the emergency. You can have equipment failures, power outages, natural disasters. These and other emergency situations can compromise vaccine storage conditions and damage your vaccine supply. It is critical to have an up-to-date emergency plan with steps you should take to protect your vaccine. Ideally, vaccine should be transported using a portable vaccine refrigerator or qualified pack-out. However, as a last resort, if these options are not available, you can follow the emergency packing procedures for refrigerated vaccines below. Next, gather packing supplies. First, obtain a hard-sided cooler or styrofoam vaccine shipping container. Get conditioned frozen water bottles, some insulating material, and a temperature monitoring device. Containers should be hard-sided coolers or styrofoam vaccine shipping containers. The cooler should be large enough for your location's typical supply of refrigerated vaccines. You can also use the original shipping boxes from manufacturers if available. Do not use soft-sided collapsible coolers. Conditioned frozen water bottles. Use 16.9 ounce standard size bottles for medium to large coolers or 8 ounce bottles for smaller coolers, but make sure there's enough for 2 layers inside the cooler. Do not reuse coolant packs from the original vaccine shipping container, for that can cause a risk of freezing. Freeze water bottles in the vaccine freezer to help regulate the temperature. Before use, you must condition the frozen water bottles. Conditioning frozen water bottles. Put frozen water bottles in the sink filled with several inches of cool or lukewarm water or under running tap water until you see a layer of water forming near the surface of the bottle. The bottle is properly conditioned if ice block inside spins freely when rotated in your hand. The ice sticks, put the bottle back in the water for another minute. Make sure to dry each bottle. Why do you need cardboard, bubble wrap, and conditioned frozen water bottles? Conditioned frozen water bottles and corrugated cardboard used along with 1 inch of insulating cushioning material such as bubble wrap keeps refrigerated vaccines at the right temperature and prevents them from freezing. Reusing vaccine coolant packs from original vaccine shipping containers can freeze and damage refrigerated vaccines and should be avoided. In order to transport vaccines, you will need a temperature monitoring device called a digital data logger, or DDL. The DDL should have a buffered probe, a current valid certificate of calibration, and should have an accuracy of plus or minus 0.5 degrees Celsius or plus or minus 1 degree Fahrenheit. Pre-chill buffered probe for at least 5 hours in the refrigerator. The DDL currently stored in the refrigerator can be used, as long as there is a device to measure temperatures for any remaining vaccines. These are the first 4 steps to packing your cooler for transport. For the first step, line the bottom of the cooler with a single layer of conditioned water bottles. Step 2 is a layer of insulating material. Place 1 sheet of corrugated cardboard over water bottles to cover them completely. Step 3 is another layer of insulating materials. Place a layer of bubble wrap, packing foam, or styrofoam on top. Layer must be at least 1 inch thick and must cover the cardboard completely. Step 4 will be the vaccines and the DDL. Stack boxes of vaccines and diluents on top of the insulating material. When cooler is halfway full, place the DDL buffered probe in the center of the vaccines, but keep the DDL display outside the cooler until finished loading. Add the remaining vaccines and diluents to cooler, covering DDL probe. Step 5 is a layer of insulating material. Cover vaccines with another 1-inch layer of bubble wrap, packing foam, or styrofoam. Step 6 is another layer of insulating materials. Another sheet of cardboard may be needed to support the top layer of water bottles. Step 7 is another layer of conditioned frozen water bottles. Fill the remaining space in the cooler with an additional layer of conditioned frozen water bottles. The final step, 8, close the lid and attach the DDL display and temperature log to the top of the lid. A properly placed emergency transport pack-out can maintain the appropriate temperatures for up to 8 hours, but the container should not be opened or closed repeatedly. Once you arrive at the destination, before opening the cooler, make sure to record the date, time, temperature, and log your initials on the vaccine temperature log. For storage, make sure to transfer boxes of vaccines quickly to the storage refrigerator. For some troubleshooting, if there has been a temperature excursion, contact the vaccine manufacturers and your immunization program before using vaccines. Label vaccines, do not use, and store at appropriate temperatures until a determination can be made. For additional resources and information, you can contact the U.S. Department of Health and Human Services, Centers for Disease Control and Prevention, CDC. Additional information can be found for storage, vaccine storage and handling toolkit at cdc.gov or www.cdc.gov/vaccines/S&H for storage and handling guide. Thank you. Thank you for joining the Washington State Department of Health.